DIDs and stuff like that. So hopefully I will not do that. So what are Medicaid waiver programs? The state of Texas, as well as the federal government, offers what they call waiver programs, which is using Medicaid funding to allow more flexibility on how that funding is spent. Traditionally, Medicaid dollars could only be spent putting individuals in nursing homes or larger institutions for long-term care and services. With waiver programs, as the name indicates, certain rules are waived or overridden, which then allows the state to use certain funds to provide, again, long-term supports for individuals that to live at home or live in other community-based settings, and not just the institutions or long-term care and services. There are multiple different types of waiver programs, and we'll talk about that, and each one of them have their own different rules and qualifications, and the dollar amounts that are spent and how those dollars can be spent for services. Most of the times, waiver programs do not look at the parental income or assets when they're trying to determine eligibility, but we'll talk about that a little bit later, as well as types of eligibility. Certain things to know about waiver programs, that they are long, extensive, what they would call interest list or waiting list, up to 12 to 14 years for some of these things. So what we always tell our families is, you haven't gotten your son or daughter on the waiting list or interest list, to do so very quickly, and to get them on as many as possible, for those that they qualify for. So that could be as early as at age 3, 4, or 5, because if by the time they are in high school or after graduation, those are about the times when people are ready to transition into adult type services. And if their name comes up on the interest list, that's great, because then they have a large variety of services that are available to them. So making sure that working with their local authority, and we'll talk about what that is a little bit later, to sign themselves up for their sons and daughters as many waiver programs as possible. Also, anytime after you do that, any type of mail or correspondence that you get, to make sure you keep all of that in a separate file or a folder somewhere, so it doesn't get lost. We've heard some horror stories over the years of families being registered but not being able to find the original paperwork, and they have to start the process all over again, or they have to do extra paperwork to make sure that their son or daughter are signed up for certain programs. So always keep anything that you have in regards to those types of waiver programs. Also, they're usually the local authorities, and I'm talking about statewide and not necessarily just the local one here, like an Acog. But they would send out an annual letter to make sure that the families are still interested and continue to be on the interest list. And always making sure that you contact them and let them know that you are continuing to be interested in those types of services. Anytime there's a change in status in regards to address or telephone numbers, we also make sure that you let the local authorities or the individuals that are involved with those programs know of those changes, so they know how to contact you. First thing we wanted to talk about before we get into waivers is a program that's called Community First Choice, which you might hear as CFC. To be eligible for CFC, an individual can be both an adult or a child. They must be eligible for Medicaid, and we'll see that throughout all of these programs. Is not necessarily having Medicaid at the present time, but to be eligible for Medicaid at a later time. But they also must meet the level of care that would generally require institutionalization of some sort. So that could be a hospital, it could be a nursing facility, it could be what they call an intermediate care facility, ICF. And for the individuals with developmental disabilities, it's an ICF-IDD or ICF-DD. Again, these are all these acronyms I was talking about earlier. So they have to meet the what they call institutional level of care to be able to qualify for these programs. That also could be psychiatric services as well, residential long-term support psychiatric services for individuals generally under the age of 21, and also institutions for mental disorders or diseases, such as like dementia type things for individuals over the age of 65. They also need to have the help of what they would call their activities, daily activities, or instrumental activities of daily living, which we call ADLs or IADLs. And those could be things like basic care skills of eating, dressing, and bathing. Those are the types of things, if an individual needs help with completing those every day, that they would qualify for the CFC program. Currently, I mean, so CFC was designed not to have a waiting list, so individuals, as it is considered an entitlement program through the Medicaid state program. So, if they meet the eligibility requirements, they would be able to qualify for CFC types of services, and we'll go over those in a few minutes. But if they're already within Health and Human Services, HHSC's programs for individuals with intellectual disabilities, then they would be getting those services through their current IDD waiver provider. So for instance, if you're already in HCS, already in the class program, the CFC program would have come in, and this happened a few years ago, and you'd be able to receive the CFC services through your current IDD program that you were already through the Health and Human Services program. If you're with STAR Plus, which is more of a medical-based program, a managed care organization program, you would need to meet the medical necessity for that, and the MCO, or the managed care organization, would be the ones that would be assessing or authorizing those types of CFC services. Individuals with intellectual disabilities would be assessed by the local authority, and in this case it would be Acog that would be assessing for eligibility, and then authorization for those types of services would be coming through the managed care organization, things such as like Molina and United managed care. So what exactly is CFC? The services that our individuals generally get, there's a service that's called PASS, and that's Personal Assistance Services. And there's another one that's called Primary Home Care, PHC. Those are types of services that provide hands-on assistance for individuals generally in their home or in their family home. And they provide, again, assistance with the ADLs, the activities of daily living. And they're also within CFC, with our side of things, within the IDD programs, they also have what's called HAB, or Habilitation. So the program combines the types of services, and it's called PASS-HAB. So Personal Assistance Services and Habilitation Services are kind of combined into one service that can be provided by a single staff member or caretaker. And what HAB services are is assistance in kind of developing skills development. So you have kind of a trainer that would be able to come into your home and help you develop skills to be able to provide you, be able to do services on your own, or again, activities of daily living, community-based skills or services, and as such. So that trainer would be helping you do skills building, as opposed to just with PASS, it's just helping you just to do the services, or do the skills on your own. And again, and as I mentioned earlier, in addition to all of this, the individual must, to meet eligibility, be able to meet the institutional level of care requirements. Again, meaning that they would generally would qualify for institutional care, such as a hospital or an intermediate care facility. In regards to the Texas Medicaid Waiver Programs, there, like as mentioned earlier, there's several of them. The first one is called CLASS, and what that stands for is the Community Living Assistance and Support Services. There's another one that's called HCS, that's Home and Community-Based Services. And then another program that's similar to that, it's called Texas Home Living Services. Then there's the MDC program, which is Medically Dependent Children's Program. And we'll go over all of these here in a few minutes. And then there's the Deafblind Multiple Disabilities Program. And then there's YES, which stands for Youth Empowerment Services. And then the last one is STAR Plus Waiver Program, which we talked a little bit about in regards to the managed care organizations. So the first one we'll go into a little bit more detail now is this with CLASS. Again, CLASS stands for Community Living Assistance and Support Services. CLASS was developed to try to provide home and community-based type services for individuals that meet their eligibility requirements, and those are individuals that have what they call related conditions. And we'll talk about that definition in a few minutes. But the idea was to be able to provide cost-efficient or cost-effective services as an alternative to facility services such as the ICFs we talked about earlier, the intermediate care facilities, or the state-supported living centers. The state-supported living centers are what used to be called the old state schools, and those are the campus-based long-term facilities. We have one here in San Antonio, and there's another one in Austin, another one in Corpus Christi, as far as our local ones. So as a more cost-effective type of service to the ICFs and the state-supported living centers, these waiver programs were developed to try to, one, keep people in the community and with their families, or at least in the community, and to do so at a less expensive rate. So going back to CLASS, individuals have to be have a related condition, which is a disability that can be other than an intellectual disability that did, as similar to IDD, have to originate or have an onset before the age of 22, but it still affects their level of independence or level of functioning when it comes to their daily living skills. One such diagnosis would be somebody like with cerebral palsy or epilepsy. But again, the individuals can also have IDD as well. You could be at any age to qualify to be eligible for CLASS. But again, one of the qualifications is that you have to have a disability that's as it's defined through Medicaid. You must meet a certain level of care criteria for placement into an ICFDD. So as those are those eligibilities we'll talk about. That it's required for all of the type of waiver programs is that your disability would qualify you for a facility or institution to be able to be eligible for the waiver programs. You must be in need of habilitation, which we talked about what that meant, the HAB program. Again, that's a skills building type of service where you have a trainer coming out to your home, as well as a case management service, which you'd be assigned an individual through your provider to be able to come out and manage your services throughout the year to determine if your needs are being met by those services. You also must either live in your own home or in a family home to be able to be eligible, and your income and resources cannot exceed a specific limit. Again, all of those, the waiver programs are different, but there are limits in regards to assets or resources you can have as far as your income. And you also cannot be enrolled in a different waiver program. But as I mentioned earlier, you can be on the waiting list for other waiver programs, but you cannot receive services at the same time, different programs. Types of services throughout with CLASS would include what they would call residential habilitation, which I was just talking about earlier. As far as the HAB services, pre-vocational dental adaptive aids. Adaptive aids would include things that are kind of medical devices. Well, it could be things anywhere from wheelchairs to walkers to adaptive toothbrushes to forks and spoons to even diapers and those types of supplies that are either not covered through Medicaid or there might be a limit through Medicaid that the waiver can pick up additional types of adaptive aids. And then there's a service that's called minor home modifications, in which there are certain dollar amounts that could be used to help modify the home that the person is living in to make it a little bit more like ADA accessible or easier for them to be able to function in that particular home. Then there's a variety of different specialized therapies. The class is known for having a wide array of therapies that some of the other Medicaid waiver programs do not have. So that's the wonderful thing about them, including like aquatics and horse, equine therapy, music therapies, and such as that. And then they also include respite, and respite is a type of service in which it's actually the service that provides a rest or break for the family members, the parents, and as it may be, the caretakers, to have a night off or a weekend off or a week off, depending on circumstances. There's a certain amount of respite hours or days that are provided. The next waiver program is the HCS, or Home and Community-Based Program. Class is probably the second largest, and HCS is the largest in regards to the number of individuals enrolled in the program statewide. And Texas Home Living was developed as a kind of a mediary between not having any services or general revenue services before you got onto something like class or HCS. But HCS provides, again, individualized services and supports, again, with individuals that qualify for intellectual and developmental disabilities. They are living with their families, or they're living in their own homes, or another kind of community-based programs such as group homes. And that's one of the differences with HCS, is they do have kind of a residential component that provides host home services, which used to be called foster care, and group homes. Again, but all these are based in the community, and also the local authority, again, in this case it's Acog. It provides service coordination, which is a form or similar to case management services. So you'll also be assigned a service coordinator through Acog to help develop your annual plan and to authorize services. You can be at any age to be able to get into HCS services. That's why we said, like class, to sign them up as early as possible as your sons and daughters. You must be able to qualify for that for care of an ICF intermediate care facility. So again, once you have the eligibility to qualify for the ICF, it's called a level of need, or an LOC, level of care. Then you'd be able to be qualified for any of the types of waiver programs. You must have a determination, I mentioned that earlier, a DID, a determination of intellectual disability. And again, that is an assessment that's done through Acog, or it could be generally done through Acog. I don't think the MCOs do what they would call a DID. But again, it's a determination for qualification or eligibility for the waiver services in accordance to the state law. And again, as I mentioned earlier, like with the class, you must the diagnosis must be before the age of 22, and you can also have a related condition, such as with the class, and have an IQ of 75 or less. Also with class, you cannot be enrolled in another waiver program at the same time. You could be on the waiting list, but you cannot be receiving two different services at the same time. and there are income and resource limits as well with this one. The other types of services within HCS would be, again, the residential options I was telling you about, group homes, host home. They also have respites as well, like similar to what CLAS has. They also have the PASS-HAB, which we talked about with CFC. So they have the CFC PASS-HAB, which allows an individual, a trainer that is a staff member from your provider agency, to come into your home to do community-based services as well as home-based services. They have also dental services. You get up to a maximum of $2,000 per year for your dental services, whatever you may need for that. Again, they have adaptive aids like CLAS does, minor home modifications. They have day habilitation, which is a little bit similar to what CLAS, but it's different. So a lot of programs like the ARC, like another program called Unicorn, have big day programs, day habilitation programs, which provides a variety of social and community experiences for our individuals, as well as potentially some pre-vocational experiences. And they have also specialized therapies that also includes behavioral supports as well. The next program we were going to talk about was the MDCP program, which is the Medically Dependent Children's Program. This is a little bit smaller program, but there are many individuals statewide that are in it. And as the title indicates, it's for children, so there is an aging out component with that. Individuals within the MDC program are generally receiving services to help support the families caring for children that have that are medically dependent or medically fragile. So there's multiple different types of diagnoses that would qualify for that. And it also encourages the transition of the children that are currently in nursing homes back into the community, whether it be with their own family or with another type of family, but to get them out of the nursing homes and back into community-based settings. These services are managed through the managed care, or MCOs, the managed care organizations. You must be under the age of 21. After that, like I mentioned earlier, you age out of that program and can go into another waiver program. But if you are under 18, you must live with your adult family or a member of your adult family, such as your parents, an adult sibling or a guardian. Or you could live with a foster family, and they do have a foster care component to that as well. One of the limitations with that is you can't live in a home that is also providing services to more than 4 individuals in that home. You must be a U.S. citizen or an alien that with an approved status and who lives in Texas. And you must meet certain Medicaid eligibility guidelines, such as have a low-income family with children through the Social Security Act, must be receiving SSI, and SSI stands for Supplemental Security Income. Most of our individuals that have Medicaid also have SSI or Social Security payments of some sort. They must be eligible for Medicaid Assistance Only program through the state of Texas, and other programs such as the TANF program, the Temporary Assistance for Needy Families, meet those criteria to be able to qualify for the MDCP program. And again, similar to the other programs, this one is not so much the ICF eligibility, but for nursing home eligibility due again to medical necessity. As same as the others, you also cannot be receiving other services from another waiver program at the same time. Services for this type of program does also include adaptive aids, minor home mods, respites, and family support services to help the families, and especially in regards to having them transition back into the community. The next program is the Deafblind Multiple Disabilities Program. This is a program that also provides home and community-based type services, and for people that are deaf, blind, and have another type of disability. This is a cost-effective alternative to, again, ICF program or a facility type program. It focuses on increasing opportunities for the individuals that are deafblind to have to communicate and to be able to interact with their environment more, and again to have it be more community based. You must have, again, a diagnosis of deaf blindness or a related condition that can lead to eventual deaf blindness, as well as another disability that is needed on a daily basis, on a monthly basis, excuse me. Again, so that could be like personal care assistance, as we talked about earlier, PASS, or as well as case management, so multiple services that are needed on a monthly basis. You must have, again, the related condition must be diagnosed before the age of 22, and you must have a level of care criteria that would qualify you for an ICF-DD. And again, there are income and resource limitations as well to be able to qualify for the individual, the program. Services that are include residential habilitation, as we just talked about earlier, that the PASS HAB habilitation type of program for that. Assisted living, where you are living out on your own, but you might need someone to come in and provide assistance for you. A chore provider situation to help you around the home. Adaptive aids and minor home modifications are also available for this program as well. Then there's the YES program, the Youth Empowerment Services Program. This is a unique program in the sense that it was developed both by Health and Human Services and the Texas Department of State Health Services. And it was done primarily to provide comprehensive services, a home and community-based type of services for individuals with mental health issues that were still young or youths. It's generally set up for individuals that are 3 to 18 years of age, and for those individuals that have a serious emotional disturbances. It could be extended through the individual's 19th birthday. So it provides flexible supports and services not only for the individual, but the family, the individual's families that are still in the community. And the idea is to continue to provide that wraparound services for them to prevent them from being institutionalized, and to allow them to continue to stay in home and not out of home service. This YES is considered kind of a short-term program, and meaning that, again, it is not only is it individuals age out of it after 18 or 19, but that if the individual gets stabilized, that their services may not continue all the way through the age of 18. And then the last type of waiver program we talk about is the STAR Plus waiver. And we talked about this a little bit earlier in the beginning. So the STAR Plus program is through the managed care organizations that we have here in San Antonio, such as Molina or United, that provide the similar services through a managed care structure. So individuals, again, to be able to qualify, need to be able to need the care services that are generally needed for nursing home. So in order to try to keep them out of the nursing home and into the community, they provide a variety of services to allow them the supports that they need to stay in their home. It's for individuals, elderly individuals, aged individuals, as well as individuals that
También como
need
individuo.
IDD services. There are income and asset level limitations as well, but an individual must be eligible for Medicaid to be able to get into this program. Again, it is provided through the MCOs for individuals 21 years or older. For those individuals that were previously in the MDCP program, the Medically Children's Program, after they age out, they can be transitioned into the STAR Plus waiver program. And these types of services are similar to what we talked about earlier with some of the others. That includes nursing services, dental, adaptive aids, minor home mods, and several residential options. They do have a similar foster care program that it's similar to what HCS has. So that's it as far as the residential, the Medicaid waiver programs. I know I went through that pretty quickly, but if there are any questions, we can definitely talk about those at this time.
Okay, Tony, it looks like we have a couple of questions. One participant says she didn't get the letter this spring. Acog told me that they sent every other year. Should she be worried?
I wouldn't be worried, but I definitely would follow up with them. Like as we mentioned earlier, especially right now with COVID going on, you should have, I take the incentive, the initiative to try to reach the person on your own. Don't rely on them to do that every other year. Everyone gets busy. You should be assigned an individual, if not a service coordinator, or at least a transitional person that you can contact every year, either by phone or by email. But I would definitely get back and not let that go by without reaching somebody by phone and finding out status, making sure there have been people. What happens, especially as I mentioned earlier about people moving, and people move all the time, is that the letters then get lost in the mail or they get returned. And there is a policy, it's a state policy, that if the local authority tries to reach you and you have not responded within a year, that you will be dropped off the waiting list or the interest list. And that happens all the time. We just got an update from the state from the first 6 months of the last fiscal year. And I'd say probably 20 to 25% of those that came up, their name came up on the interest list, were dropped because of lack of communication or follow-up from the families. That's and again, some of them may just not be interested after 10 to 12 years, but some of them may be interested and just didn't know that they needed to follow up, and then they have to start the process all over again. So yeah, do not let that happen. I would definitely follow back up.
Okay, and then we have one that was asking for clarification for class. No one cannot have IDD. Please repeat. I think the person was confused.
Yes, I apologize. No, they can have IDD for sure. But one of the big differences is that they can also have related conditions, which means we may have an individual that has cerebral palsy and may not have, again, I'm going to say an IDD. Their IQ, as I mentioned, with related conditions has to be 75 or less. And I know we're just talking about small points here on the IQ scale, but individuals with intellectual disabilities is 69 or 70 or less. So there is a little bit more room there for individuals with related conditions. But for the most part, yes, they can have IDD.
And then we have, what is the average wait time on each list?
Well, it's a combined list. The interest list is combined for all services. And last I heard, and this is really kind of pre-COVID stuff, is the state list was up to over 140,000 people. So that included all the waivers we just talked about. And again, and that's not a duplicative list of individuals that may be on multiple lists. Those are all individual names. But the average is about 12 years for an individual to stay on, to receive any type of service. So they may get on at age 8, and before they receive notification from the state that their name came up, whether it be for class or for MDCP, it could be, they could be 20 years old.
And for class, I think they're saying right now it's about 16 years. So we typically tell families that the wait list is about 12 to 16 years, depending on which program you're going for.
Yeah, and usually HCS Texas Home Living is 12 to 14 years. MDCP, where it's more focused on children, it may be less because they want to get the children. It doesn't do you any good to have to wait 12 to 14 years, and then by the time your name comes up, you're aged out. And the same thing with the YES program, which is up to 18 or 19. So those types of waiting lists are a little bit smaller, but the issue is always about funding. The question always comes up: well, why is the waiting list so long, and why does it take so long to get a slot, as they call them? It's a funding issue on the state level, where the state does not. Every year they allocate a certain amount of funds to take people off the list to provide more service or individuals for services. And so it depends on the state economy. If it's a good year or a good couple of years, they release more funds to us. If it's not, then the previous 4 years up to prior to last September, no one was coming off the waiting list unless you were aging out of programs such as Child Protective Services or coming out of a state supported living center or nursing home. No one that was on the interest list alone was coming off because of lack of funding on the state level.
Right, and I think in September, they only released 500 class slots for the entire state of Texas. So that tells you.
And that's for 2 years, yeah.
Then we have a question: is there a master contact list for each, for all the lists?
Well, it's going to everything is going to generally go through your the Acog or your local authority. They're going to have the master list. They're going to be able to tell you which programs you were eligible for and which you've been signed up for, and potentially, they could tell you where you're on the waiting list. They can tell you, well, right now it's showing that you're 8,452 on the waiting list. They can't tell you how long it's going to take because they don't know that, but they can give you a number. Your letter will generally tell you that as well. But they are the ones kind of the keepers of that. Of course, everything is really kept through Health and Human Services in Austin. The MCOs don't necessarily have that list, that master list. They just are, as individuals come in through the Star Plus program, they're able to offer those types of services through Star Plus, but not the other programs like HCS or Class.
And I would just follow up with that. If anybody on the webinar is needing help getting connected with these programs, feel free to call the ARC of San Antonio, ask for the case manager of the day, and we can get you triaged to the right program and get you connected with any other resources as well. Okay, we have a few more questions. I have an 8-year-old with IDD. We have not had her IQ tested. Do we have to do that before putting her name on the Medicaid Waiver Program list?
So she's been diagnosed through the school district, I'm assuming.
Yeah, it says that she's got an ID, that she's IDD.
Okay.
But they just haven't tested her IQ.
So you're going to want to do that through Acog. You make an appointment with to get that DID, that the determination of intellectual disability. That's it's an assessment, eligibility assessment process that will assure that she's qualified for multiple of these types of waiver programs. They will look at her school records if she's already in special ed, if she's already been tested by the school district's psychologist to determine IQ. If that hasn't occurred through the school, they can do that there at Acog. And so it's a process that might take multiple appointments, but it can be done through them. So they're kind of like the front door for these types of services. So you would need to call Acog, the IDD services department, and ask for to get your son or daughter tested or for eligibility for services.
Okay, and it looks like we have a couple more. Does group home adaptive aids include railing on a ramp or dirt added to the side of a sidewalk drop-off?
Sorry, I'm sorry.
Does group homes adaptive aids include railing on a ramp or dirt added to the side of a sidewalk drop-off?
Well, for clarification, an individual that's in a group home, the provider that's operating the group home would need to provide any type of minor home modifications such as ramps to do that. And it doesn't have to come from the individual's funds. Now, if the individual's living at home, family home, or their own home, then you can use your minor home modification funds. In the HCS program, it tops off at $7,500 lifetime. So you could use it for ramps and rails, or to build up, I don't know, they mentioned soil. If that's part of the process to build up a ramp or ramp system, yes, it could be used for that.
Okay. I'm trying to figure out which program my child would qualify for. Is it fair to say class requires a physical disability of some sort so that someone who has no physical disability wouldn't qualify for that program?
No, I think. And again, Allison, I'm sorry. She was asking if they only had a physical disability to qualify for class.
Yeah, it looks like, let me read it again. I'm trying to figure out which program my child would qualify for. Is it fair to say class requires a physical disability of some sort so that someone who does not have a physical disability wouldn't qualify?
No, I don't, for the most part, the programs, the waiver programs do not require that you have a physical disability at all, like cerebral palsy. It's more on the related condition diagnoses, IDD diagnoses, that again, determination is regarding if you need care that would require you to be in a institutional setting such as the ICF homes or a state supported living or nursing home. If your disability requires that because you're not able to do things like feeding and eating and drinking, then you would be eligible for the waivers programs with or without a physical disability. You don't need to have a physical disability to qualify for any of these programs.
Okay. And then how often does the state review change or amend criteria for the list? How do you find out about the changes?
For the list?
Right.
They, the Health and Human Services, which is the keeper of the list, by I don't say by law, but they have to report. There are legislative committees that monitor. It's a funding issue through the state, needless to say. So they have to report quarterly to the state how many individuals that are coming off the interest lists and which programs are going into. As I mentioned, so we see these as well. They're released to us. So we'll see. Let's just say 500 were released in the last quarter, and that's a lot. That doesn't happen all the time. I'm just kind of rounding up the number. But only 300 took slot. Some of the others refused. Some of them had eligibility issues. Some of them moved out of state. Some of them have passed away. There's a lot of different reasons why some of the others do not get into the program. So all these categories are reported to the legislative committee each quarter, and that's how it's updated. So individuals come off the waiting list for various reasons. They either accept the program or they come off for maybe becoming ineligible for another reason or so.
Okay, and then we got just a couple more. Will Acog come to the home if the child is medically fragile?
Yes. Needless to say, there are some limitations now with COVID, but prior to COVID, they would send a service coordinator. They would prefer, again, it's a combination of things, but they will definitely come out to the home. But to qualify or to do that, the DID, as we talked about earlier, the eligibility determination for intellectual disabilities, that may need to be done at the Acog building because of testing materials and such. But the initial appointments can be done in the home, and there may be exceptions to all of that. If the family already has reports, like from the school district, that determine eligibility, like there's already been an IQ test done, they've already had a determination of needing for special needs services. All that could be taken into consideration by the psychologist, and additional testing may not need to be required to have them come into the Acog office. And so there are exceptions to if they are not able to go into the office, that they can be, everything can be done at the home, or by email or by phone.
Okay. We'll do just a couple more, and I think that's pretty much it. For a child with IDD and no medical issues and not needing help with ADLs, is it generally best to apply for HCS and class at the same time?
Yes, yeah. As we mentioned, definitely would sign up for as many as you can that you're eligible for. Texas Home Living is another one. Don't forget about Texas Home Living, because that will come up before class or HCS. And even though they're not funding that as much now, but that was the intent of why it was developed in the first place. Is it was a kind of a step up to class and HCS. It's like, let's get some of these people some services and not languish on the interest list for years and years and years. So Texas Home Living does provide some services, which is good. It used to be called HCS Lite for that reason, but until your name comes up on class or HCS, it's definitely worth signing up for it, because you do get things like dental and DAHAB, some of the therapies, and PASSAB. So it's definitely worth signing up for Texas Home Living as well. Don't forget that. But if your son or daughter is relatively somewhat independent and high functioning, HCS and class would try to sign them up for those as well.
Okay, and we have just two more. Is there an age out for class, like 18?
No.
No. I knew that one. Which program provided financial assistance with medical devices and aquatic therapy?
Class does the aquatic therapy. Medical devices, there is, I think most of the programs have something like that through adaptive aids. Whatever is not paid through Medicaid, straight Medicaid, when it comes to medical devices, like a wheelchair. Most wheelchairs and walkers are covered through Medicaid. But if there's additional adaptive aids or medical devices that are not, or in addition to what's above and beyond what Medicaid pays for, then the waiver programs have that funding to be able to do that.
Okay, perfect. Thank you, Tony, so much. It looks like
You're
that's
welcome.
the end of the questions. Just in closing, we encourage everybody to get involved in helping to protect the rights of individuals with disabilities. There are many ways to show your support for individuals with disabilities, including completing the 2020 census. There's still a couple of weeks left to do so. It ends at the end of the month. It is estimated that nearly 40% of Bexar County households still have not responded to the census. Your contribution to the census will last for 10 years. The government uses census information to make crucial decisions. These decisions affect people with disabilities. In addition to affecting our representation in Congress, census data impacts funding for public transportation and roads, healthcare, and education programs. It takes just a few minutes to make a huge impact. Every single person living in the US has the right to get counted. If you haven't already, fill out the census today at my2020census.gov. Help us to create movement to ensure all people who have disabilities and their families and friends in Bexar County are counted in the 2020 census. Later, you will receive an email with a survey for your feedback on this webinar. The survey also asks for ideas that you may have for future webinars. The email will also contain a link for the recording of the webinar on the ARC's YouTube channel for you to refer to later. Please watch our Facebook page for future webinars. Thank you so much for joining us today. Please stay safe and take care. Bye, everyone.
Thank you, Allison.
Thank you so much. Bye-bye.
Bye-bye.